Contact tracing is all about finding those positive cases, of course, and then finding the people they have been in contact with. But is Arizona capable of doing that? We're asking that question at the same time an influential modeling team is suggesting that Arizona's deaths could soar, actually peaking after the 4th of July. So is Arizona ready for that? And if so, what's the plan? ABC 15's NICOLE GRIGG trying to answer that question tonight.
The governor's office will not answer that question directly. If they would turn back that dimmer switch, so to speak, they say that they'll continue to follow the facts, the guidance from the CDC and top public health officials. It's the model from the University of Washington drastically changing now that our state order is over, predicting 100 deaths a day the second week of July. ABC 15 data analyst Garrett Archer says it appears they may have changed how they're modeling by adding social mobility data.
I think at this point it's too early to be apprehensive that we're going to get to 100 deaths a day. We're going to have to watch what occurs in the next 2 weeks and see what the numbers look like.
Arizona is still nearly last for testing per capita in the country.
Can't explain it. I don't know why that is.
Will Humble, the former top public health director, says testing leads to contact tracing, which leads to those exposed.
Low testing capacity is a bad thing. Not being able to get your folks in nursing homes and assisted livings and prison environments tested is a bad sign. Not having enough contact tracers is a bad sign.
In a press release the last week of April, the state says they'll be doing a testing blitz to test 10 to 20,000 Arizonans every Saturday, but they're far below those numbers. The first weekend, 5,400 tests, and the second weekend, 9,700.
To me, rather than extending the Saturday testing for another couple weeks, which I understand that they've made that commitment, hopefully that's not using capacity, testing capacity that could have been used in assisted living, skilled nursing, and correctional institutions, but we shall see.
The latest ASU modeling shows it will take about 3 weeks to know the impacts of the governor's plan to reopen. We asked if they expect cases to go up.
The simple answer is yes. Anything that we open up is going to have an increase in transmission, and our model explicitly accounts for transmission.
Contact tracing is also key to opening back up. So when someone is positive, we can track down all those in contact. The state's top public health director saying 2 weeks ago they're working on adding state teams.
So we are continuing to pilot that, and it will be in place by this Friday.
But we've asked the state for an update since then with no clear answer on those teams. And it all goes back to testing.
If you have good surveillance data and it shows that your new hospitalizations and your new positive tests are moving in an exponential way, it's time to flatten that curve again with some more stringent interventions.
The governor's office responding today about lack of testing, saying that we had shortages of supplies early on, and now we're making significant progress. However, the numbers do not support that claim. In Phoenix, NICOLE GRIGG, ABC 15, Arizona.